living in the United States, we don't really have an organization like the British Acupuncture Council. So I think most acupuncturists in the UK don't really appreciate the great thing they have. This gathering of people from all over the country and having speakers from everywhere come and speak is just something we don't have.
Alright, we're going to start, otherwise you're going to be late for your next session. So this is commissioning acupuncture within the NHS. Welcome. So I'm the Chief Executive of the British Acupuncture Council, and I've got quite a long background working in the NHS. So I worked in public health departments and also worked as Commissioner for a variety of services, mental health, carers, acute. So I do know about the NHS pretty much inside and out. Although obviously changes are happening very fast now, so this is a snapshot for now.
My name is Vivienne. I'm the chair of the Acupuncture Association of Chartered Physiotherapists. So through my career I've worked in the NHS and outside the NHS, so as a private practitioner and within the NHS. So most of you guys are private practitioners, so kind of working from both fronts really. We are helping a lot of physiotherapist departments and things, working with commissioners trying to keep acupuncture at the forefront really. So Nick and I have been developing a few of those together, so that's why I think Nick asked me to come along today to give you some insight into how things are for us, so that you can perhaps learn from our ways and make them better, I suppose.
So strategically, the fact that we're British Acupuncture Council and AACP, the physios here, is quite a kind of important statement, because I think certainly at a national level we feel we've got a good collaborative relationship, and there's ways in which we can kind of work together to provide acupuncture to the general population through the NHS, and we think that's a good thing. I mean, locally obviously there are differences and there are challenges, and we all kind of hit those head on as we go through, and obviously questions at the end. So this is what we're going to cover. We're going to just explain what is commissioning, who commissions, the policy context, preparation, the ask, making the case convincing, and questions. And I think if there's one thing you can take away, it's really to give you confidence that you can go to NHS commissioners or people in the NHS. And I personally, people have asked me what it's like to come in and be a Chief Executive of British Acupuncture Council, and what the acupuncture's like. And I'm enjoying it. It's a great job. You're all brilliant. But there's one thing that I'm slightly disappointed about, is that there is a kind of confidence issue I think that some of you face, maybe for good reasons, to really get in there and feel that you're an equal health professional talking to people in the NHS. I feel that there has to be a step up there for you to get success, but I'm seeing there's some cases where you just cannot do that, and I do understand that too. So what is commissioning? It's kind of a terrible word, but it basically involves someone like me in our old job is assessing what the health needs are for a local population and how services meet those needs. So in a situation where I was in a city, London, where there's refugees and people with complex health needs, you need certain health services. In places like kind of leafy Dorset, it's other services, for example, for older people that you need more. So you do obviously need to tailor the services as an NHS commissioner from place to place. So you identify those priorities through kind of data analysis and design those services to meet patient needs and demands with providers. And that's where you need to get involved, because as commissioners think, God, we really need something to support musculoskeletal services, they think, well, who's out there who can provide it? And if you're there at the beginning of the conversation, that's a good thing. Commissioners ensure services are provided effectively and monitor quality and outcomes, and certainly they do that. It's obviously getting tougher and tougher with the current NHS funding situation. So there's a kind of circularity of the commissioning cycle. I talked about assessing needs. You review what you've got there, you decide your priorities, so refugees or older people, you specify the services, so it's kind of a hellishly complex document just saying you want sort of 50,000 patients delivered within the year for musculoskeletal services within 6 weeks, something like that. You shape the structure of supply, so you say, well, it's going to be in kind of GP services or hospital, or another place, maybe acupuncturist, and then you manage the demand, so you make sure the right people are coming through. clinical decision making. That's the actual service actually happening. So there you go, kind of round and round and round. It is complex. So who commissions, and all the kind of NHS kind of stuff that's happening in the papers is about England. Scotland, Wales and Northern Ireland, I think, have got a really better choice of kind of keeping things pretty much the same. In England, it's shifting from PCTs, primary care trust, to GP commissioning services, or now with other providers. Scotland, 14 health boards, Wales, 7 health boards, Northern Ireland, health and social care boards. So they're kind of places where, again, the commissioning happens. And there's a new thing coming through which we're quite interested in for you, which is individual service budgets, and that's an opportunity that we'll keep you informed about. It's kind of quite early days, but we do think there could be an opportunity for people to be given a budget and then say we're going to spend it on musculoskeletal, and those people, I think, will really want to choose acupuncture. So this is a kind of, I think that they're almost creating a structure that's so complicated they can't make a decision, but it's basically the current things. You've got your primary care trusts, and then they commission to hospitals, and then that affects patients. And the proposed is, well, now it's no more GP consortia, it's just a consortia who will then commission, and there's an independent NHS board that also gives money to doctors. It's really, I don't know, it's not great, but that's...
Adding policies, aren't we? So taking them away.
Yeah. So just to drill in a bit on England and the kind of policy context. So there's these commissioning consortia and sort of PCTs. There's something called any qualified willing provider, which Vivienne will talk about. I mean, this is a key point here. You need to keep your nose to the ground when recommissioning happens, and I think what's there's a kind of muddle out there as things change. I'd say that muddle is an opportunity for acupuncturists, because the decision maker for NHS will change. It's this commissioning board, so that from it being quite a locked-in situation, there might be an opportunity for you to then talk to new decision makers. There's a focus on outcome with patients at the heart of everything, and there's real cost pressures, but that could be advantages for acupuncture, disadvantages, I don't know. So Vivienne's going to talk about any qualified provider.
So any willing provider under the previous health and social care listening exercise became any qualified provider. Something that Nick and VXC are going to be working quite hard is to kind of get to grips with what qualified provider means. Currently, they haven't defined qualified provider. There is a feeling that it's going to be HPC registered people, which we would all groan about. But there is a footnote on a few of the documents that say members not regulated by the Quality Care Commission will still be able to become qualified providers. So there's still scope for developing that. So I think it's really important to be at the forefront to make sure that we're actually shouting very loudly as acupuncturists and telling people that we do want to be involved in these services. So any qualified provider, the scheme has actually been set up by the government to provide extra choice for patients. So they're really looking at personalising treatment and providing additional choice, allowing patients to have more options available to them. At the moment, if somebody has low back pain, really they're in a lot of places their only option is to see a consultant, have injections, nerve blocks, or see a physiotherapist. Some areas that it has already changed, but with any qualified provider scheme, that will be opened up to anybody that's willing to sign the contracts and provide services to the NHS. The intention is that it empowers patients and their carers. There is a whole other issue about what patients' knowledge and what they're able to process and know, and what services they will and won't access. So there's lots of work to do on this, really. But essentially the goal is to provide more choice. Time frame wise, 30th of September is the end of the engagement process. So they've gone out to the PCTs, they've spoke to them about which services in their area they're going to be looking at. 31st of October, the commissioners they're putting groups of PCTs together. So a primary care trust will work with 3 or 4 other primary care trusts, and they will decide which services they're going to put on the Eddie Qualified Provider Scheme for their areas. Their choices are musculoskeletal services for back and neck pain, adult hearing services, continence services, diagnostic test services, wheelchair services, podiatry services, venous leg ulcer services, and primary care psychological therapy services. So the PCTs will choose the 3 that are most specific to their area, 3 or more it says, so we don't know exactly what's going to happen with that. The plan for implementation will be from April 2012 through to September 2012. So in your areas there's probably going to be quite a lot of change with regard to how the services are provided, really. Budget. Money. The idea of any qualified provider is that we provide more services and a greater range of services to people. However, we do have efficiency savings of £20 billion in the NHS. So it's going to be down to the GP and the commissioners to decide which are the important things for their patients that they want to fund. It's a kind of a watch this space, really, and make sure that they're kind of marketing yourself as well. Okay, where they've trialled this already in North Essex, and for the back and neck services, and what they've done is they've gained physiotherapists, chiropractors, and osteopaths. There was no acupuncturists in there, I'm afraid, and they've actually piloted it. And anyone with those services can choose which provider they go to. They're allowed 4 sessions, and that's it, discharged. So that's where the service is going. So it's kind of working within that, really. The service will then be rolled out. So the plan for next year is it will be then rolled out to other services. So it will be rolled out to maternity services, speech and language therapy services, long-term conditions of self-management support, which is again somewhere I think acupuncture can really start to influence, community chemotherapy, primary care psychological therapies as well. And the key is that they're looking to outsource the services. So Nick mentioned personal budgets. If personal budgets does come through and does come off, I think it will be fabulous for all those people that are providing services that people can engage with. So definitely some more work for us to do there, really.
So yeah, back to me. So preparation. It is all this change happening. It's all very confusing. I suppose as I said before, try and find out who is making decisions within your local area, be it still the primary care trust or these new commissioning boards. And we've talked about 2 things: any qualified willing provider and individual budgets as ways of where money might be. And just on a kind of wider basis, I do think the government's trying to make efficiency savings by taking out people from within kind of NHS trusts and big NHS organisations to set up social enterprises for somebody to then be commissioned, and therefore being able to drill down staff costs, reduce staff costs because they won't be under NHS contract. So if you can understand the logic of which is they're trying to keep a lid on NHS staff costs to achieve these efficiency savings by creating sort of smaller units where they're outside NHS contracts. And I do think, although it's kind of bad news for the physios who are under NHS staff contracts, you could say it's extremely good opportunity for you as acupuncturists because you're small business people, not an NHS contract, and you could potentially offer a competitive service. But you had a quick question. I need to take quick questions because of the time.
Where do I find these?
Ask this. So ask your primary care trust, or look on their website. So there'll be wherever you live, I don't know where it is. There'll be a primary care trust, and they should have a commissioning plan. But because the nature of these changes is so fast, that might well be out of date. But it's still worth looking at to understand their strategic objectives and start to talk some of their kind of crazy language. Because if you read that, you'll start to talk about acute sort of hospital savings, all that kind of nonsense. So you do need to start sort of seeing that you're talking on the same page as NHS decision makers. There's a whole thing about the evidence base. We do suggest that you do look at your patient outcomes, that you have a conversation with them that's on their terms. I know that acupuncture is coming sometimes from a different position, and I respect that, but if you're genuinely interested in the NHS funding, then you have to kind of play their game, and that some of those things might be really looking at what the research base is, explaining that for whatever you want to bid for, and looking at your own service and using MyMod perhaps. That's the key point, really. Just build those relationships. Sometimes you'll get there, sometimes you won't. It's down to people and whether they really understand acupuncture, and you can meet them halfway. So these are some of the opportunities. I've talked about the kind of contract ways, which is any willing provider. There's the personal budget things which are starting. The NHS toolkit talks about kind of mega contracts, which some acupuncturists have gone for. Whole pathways, whole clinics. I mean, that's a really kind of grown-up game to play. Some acupuncturists have gone for it and have bid for it, and you can see that in the NHS toolkit. And some of the places where you could get some really big contracts are, with pathways for musculoskeletal, with intermediate care between hospital and GP, and in hospitals with pain clinics. I suppose on a pragmatic basis, I'd encourage you, if you're just starting off, to just start having those conversations with GPs in particular. GPs are key decision makers. Trying to get just some referrals through, even on a kind of private basis. Maybe building up to a small contract, perhaps under any willing provider, and then sort of working up from there. So, I mean, these situations here, opportunities for much bigger contracts, and I don't want to scare you off. I think it's best to start with just making those relationships and getting referrals, and that can lead us to a small contract.
I've been speaking to Nick and Susan about the experiences that physiotherapists have in the NHS, and I think what would be really good for you is to go in with open eyes, really, about the services and politics that you will be getting involved in and need to be prepared for, so that you're actually confident and able to stand up and argue your case if necessary. I've got some feedback from some physiotherapists around the country, and also some BACC members around the country of their services that they're working on. So I just wanted to give you some information on those, really. I already mentioned to you about the any qualified provider trial in North Essex. One thing that perhaps people that are in private practice don't realise is if you're providing an NHS service, this is at the moment, this may change. If you're providing the 4 sessions or the 3 sessions or the 20-minute sessions or the half an hour sessions that you're allowed to in your practice in the NHS, you're not then allowed to see that patient privately. Okay, that would be termed as unethical. So some of my colleagues will see a patient for their 3 sessions, 4 sessions, 5 sessions, or whatever they're allowed for low back pain, shoulder pain, knee pain, whatever it is, and then they have to discharge them with self-care. Many patients say, well, can I pay to come back and see you? And at the moment, as physiotherapists, we have to say, no, I'm really sorry, you're not allowed to do that. Some trusts have set up services where they have got private services running perhaps in the evening. The patient has to then re-refer themselves back into them, but you can't actually give somebody your business card and say, come and see me down the road. It's not actually allowed. And as physiotherapists, we would be struck off for that activity. Okay, so if I was in the NHS seeing a patient and somebody wanted private physiotherapy or private acupuncture, I'd have to say, have a look on Google, have a look in the Yellow Pages and find a practitioner. I can't even recommend my friend down the road, if you like. So it's quite strict the way that you have to follow the rules and the processes, which is perhaps something you guys do or don't know about, I'm not sure. From a very positive point of view, being in the NHS, I mean, from an acupuncturist point of view, I think there is a certain amount of kudos with kind of getting acupuncture in there, really. And I think some of the successful bigger bids that have gone through have been in perhaps in chronic pain departments and working with those that have got intense pain and working with those pathways. There's quite a lot of joint working between physiotherapists and the acupuncturists in departments. And I know there's a little bit of uncomfortable, where do our professions kind of work together or not, and we both appreciate that, and I think it's better that we all work together for the future of acupuncture, really, for patients. So that's probably where we're aiming for, but we understand that there may be some issues along the way. So positive in that respect. Very positive in is the if you're working for the NHS, you have your salary, you have your benefits, etc. Things like that. On the ground, we have physiotherapy department at the moment down in Brighton. It's just become a social enterprise. So they've gone from having NHS contracts into being a social enterprise. For them, they're all petrified of the potential future, because they don't know their contract's going to stay the same, the terms and conditions, for 3 months. At that point, they're then owned and governed by a private company, and they can change the terms and conditions as they feel appropriate to their private companies. There's a lot of change going on right now. Some practitioners, whether physiotherapists or acupuncturists, are very frustrated because they're told how long they can have and how many sessions they can have. For some practitioners, that's not a way that they're happy to work. If you want to work in the NHS, they're the services that you have. You have so many patients coming in that you can't give everybody, 100% fantastic service. Now, if you're used to working in private practice, you're probably used to offering a gold standard service. And the NHS perhaps would like to aspire to that, but actually real life terms, providing a gold standard service on the budgets that we have is not possible. So people are perhaps waiting 18, 19 weeks to come and see you, then you only get 2, 3, 4 sessions to see them and have to discharge. It's a little bit like a conveyor belt. You have a lot of physiotherapists that love being in the NHS, and then you have the other side, which is a frustrating place to work because you're restricted by bureaucracy, really. As far as paperwork goes, again, I'm sure you have all your own paperwork to do. There's a certain set of paperwork you have to do if you're working for the NHS. Things like abbreviations wouldn't be allowed. You'd have to write in a way that a document could be taken, in front of a legal court. So, there's all the paperwork side that you have to kind of factor into that as well. I don't want to paint a completely bleak picture, but I just want you to...
yeah, you're looking a little bit shocked.
Yeah, I just want you to know what the real world is like for us in there. And at the moment we are having commissioning battles. So we've got a commissioning battle going on in Scotland and also one in England, and we're putting together a commissioning pack at the AACP to support our members with the commissioners, because if they take acupuncture away from the physios doing it in the NHS, there's just no hope for the acupuncture getting in anywhere. So, and one of the things that we've spoken at length about is if there's any acupuncture happening in the NHS, there's a feed through into private practice. So, as a physiotherapist, very rarely a member of the public would come to me and say, I'd like acupuncture. It doesn't happen in real life. They come to me for physiotherapy. It's normally me that says, have you thought about having acupuncture as part of your treatment? And then they often go off and seek a practitioner. So it is fantastic kind of word of mouth. On a personal note, I worked in the NHS for 4.5 years, and personally I felt that I was too restricted. I didn't enjoy my job. I wanted to treat my patient fully. I didn't want to finish them after 3 sessions. I wanted to actually, so I went into private practice, and I've worked with the NHS but from the outside. So there are many physiotherapy and even acupuncture clinics that have NHS contracts but working on their own private terms. So your patients come to you through the NHS contract, but you're actually treating them in your clinic. So I think from a personal point of view, what you all need to do is look at how you want to access the NHS, and I think we need some on the inside, some working alongside, some working in private practice. And so, sorry.
Just on that point, is that more on a service level agreement basis though, where the patients are paying privately but the referrals are being made from the NHS?
It both happens. So some practices have an NHS contract which is paid by the NHS. So they can come and see a private practitioner, but the GP pays for it, or the NHS pays for it. So there's one in York they've just lost their contract. So they've had a GP contract for 4 or 5 years, and because of the changes that have just happened with the commissioners in York, and they've gone to social enterprise, that private practice have lost their GP contract now. So there's a massive change going on. So, but both can happen. So if a patient would have to go to their GP and say, I'd like to see somebody privately, for the GP to say, access this or that person. And again, with the NHS, you're not allowed to necessarily recommend somebody. They would have to give 3 or 4 names out. So, and normally it's have a look on Google or have a look in the Yellow Pages. So, I think that was the majority of what I wanted to say. Something else to say something?
I think that's it. I mean, I'm a bit worried. I'm, sensing the time, but also the mood in the room. That I do. It is after lunch, and you think, oh my god, this is the worst thing I've ever had. I mean, I personally, I'm much more positive about the opportunities in the NHS than perhaps we've talked about up to now. I mean, that's why this NHS toolkit is being produced. I mean, we do positively think. It's not just me coming from the NHS. That there's a variety of people who work in the NHS who think there's real value in serving the whole population. Whoever comes through the door, that's a great thing. I think the NHS, I absolutely believe in it as a great health system that we should be proud of in the UK, and we should work with that. And I don't think it's going to be going away very soon, although these changes, you could argue, are worrying, but there's still going to be 110 billion quid's worth of spend on health, probably through government for the foreseeable future. So, if acupuncture has a future as a mainstream provider, which I think it should be, and I think that's where you need to place yourselves, then you need to take this seriously. And it might not happen now, but you need to understand where it is now and think, okay, there might be some opportunities in your local area. Often based on personal contacts, like I know, a GP who really understands it. So, coming back to kind of making the case, and there you are with your kind of elevator time with a PCT person, a GP. I think you need to start making the case about how acupuncture can improve outcomes. You know the story. It's all on the ARC website or our website about what the evidence is: pain, mental ill health, musculoskeletal. These are kind of the big areas. Vivienne talked about musculoskeletal, neck and back pain coming through quite early on any willing provider, and that might be kind of one of the key areas I'll be looking at. There's no doubt that it will reduce long-term demands for health services. Repeat visits, prescriptions, referrals to other pathways. The evidence base clearly isn't that strong in this area, and you just have to say, this is my experience. Perhaps you need to do an audit, or you just say, this is what happens. And I think GPs are much more, as decision makers, are much more understanding of local realities. I think you can have a conversation with them, the difficulties of dealing with patients with whatever they come through, and the fact your experience actually, I think, is quite similar to GPs. We talked about personalisation and how it can support that. So you're talking a bit of their language, they'll like that, they'll be confused too. Support healthy lifestyles. I think health and well-being, this government will be kind of trying to retrench the NHS to deal with the kind of core acute issues, and they'll say it's your responsibility to take on the kind of healthy living. But there's a kind of whole health and well-being board angle that's come through from local authorities' side, and they'll be looking at health and well-being. They might have some money. There's a whole public health England is going to happen, and I don't know how that's going to be spent out. It's going to be supposedly it's kind of 3 to 4 billion there, and that will be for things like stop smoking, being healthy hearts, etc., and healthy lifestyles, and acupuncture should be part of that. So convinced again. You need to talk about us there, and one of their immediate questions will be the evidence base, which I just talked about, but they also who are you, how can we trust you, we haven't heard about the British Acupuncture Council. You need to just, throw all this at them, that we are, as Andrew Lansley said, robustly self-regulated, so which, that's not nothing. That he's saying that, we're happy for you to be as you are, and we've got all this in place, and you need to feel the backing of BACSI gives you confidence. And again, maybe I'm biased, but I do think BACSI is a good organisation when you compare with other similar organisations who, I think I talked about the CHRE process, where people are looking to join a statutory organisation once you register, and we're kind of probably second out of a field of sort of 15 to 20 in terms of the quality. I've got no doubt about that. We're right up there as a really excellent organisation that people should feel kind of proud of, and that you can then place your ask to kind of key decision makers. So you do all these things, you provide patients. This is kind of patronising saying it to you, but I suppose what I've got to say to you is, do you feel confident about who you are? And it's not about you kind of carrying down to these decision makers. They're kind of people like you and I, and it's really a case of they're sort of desperately trying to kind of deal with kind of pressures on health spend and get solutions. I genuinely think that you've got a solution to offer to them.
Quite often though, particularly locally to me, the GPs, they have to refer to the referral centre, and then the referral centre determines where they actually go.
Yeah.
So how do you break, that's the kind of issue. How do you break
that's a tough one. Well, that's just to explain it. So you've got GPs, got a whole load of referrals coming through. It goes into a pinch point referral centre and then gets banged off, because what they want to do is just check there's not some kind of over-referring or kind of dodgy referrals. And I think it's very difficult from that referral centre to get in.
Yeah.
That is a tough ask, because you'd have to go into kind of big clinical decision-making bodies to put acupuncture on that list. I don't think that's going to be any easy to do.
No. That's kind of where I'm at, because I've sort of made inquiries to see what the process is.
But that's why it sometimes gets broken down to pathways. So if it's an MSK pathway, musculoskeletal pathway, they'll review that, what's going on with that, how can we change it, and acupuncture might join it, and then that'll get bolted into the referral centre.
Because the GPs aren't allowed to refer directly, then they can't recommend or anything. So
what I would say though is if you speak to the GPs, offer to go and do an in-service training, offer to go and talk to them about acupuncture, try to talk in their language. I have a great respect for TCM and everything, but if you start talking to your average GP in TCM terms, they'll just switch off. So if you start talking to them in their terms, so you talk about healing, blood flow, and having an effect on the tissues. Obviously, you have your own values as well, but if you talk to them in their terms, and offer to go and do a lunchtime chat, offer to provide some treatment for the GPs. What will happen then is the GPs in your area will then sit, discuss the review boards. Why haven't we got acupuncture in there? And it's almost that PR and marketing thing that will lead to it being added just from some GPs saying, why isn't acupuncture on our list? And that's what will happen. So it's kind of trying to influence the smaller areas really. I'd encourage all of you, every time you see a patient, send a GP letter. I'm not sure if you're already doing that, but every single time you discharge a patient or you're seeing a patient, write to the GP. Say, just to advise, I'm seeing your patient, they've presented with this, and I'm treating them for X, Y, and Z. I wouldn't go into detail from TCM acupuncture point of view, but just in a Western way. But that's a really good way of kind of marketing yourselves locally to your GPs. Which the more you mention the word acupuncture, the more they'll get embedded into that society. GPs don't like what they don't know. GPs, I don't mean to talk patronising in the way that I say that, but they've got the referral pathways, they're happy with who they refer to, and that's what they do. And nobody challenges it, and it just carries on. So I think by kind of influencing that then.
So I've got this NHS toolkit. I just want to kind of quickly, make sure if you haven't got a copy, there's more copies on the Graxi stand. It does talk about all the things we talk about, the top tips. What's going on in acupuncture, what's going on in terms of commissioning, what the ask is for acupuncture. It's got some research fact sheets on the key areas there. It's got a letter that we wrote to GP commissioners, so you can see some of the language we use. There's a flyer, there's an example of a contract, and also an example of a letter that we sent around personal budget. So have a flick through this and get a sense of what you think you can do locally. And I'm here for you, and this is a project that I'm putting time into personally. So talk to me about what your local issue is. I'm happy to do a call or even attend a meeting if it's a key kind of meeting, clinical commissioners meeting. These I think I've covered all this: health and wellbeing boards, personal budgets, Health Watch, which is the new kind of local health watch jobs. It used to be CHCs, used to be something else, but it's now going to be called Health Watch. Read the toolkit, make links with ACP. They're nice, they're lovely. I've got the husband to be here to watch me. So these are examples of NHS funding for acupuncture. So Mend It, the Gateway Clinic. All around the country there are acupuncture embedded within the NHS, and like Vivienne says, it does lead to all kinds of benefits just for other acupuncturists, but also it's long-term sustainable funding potentially, and that is the golden challenge. Is that once you're there, you can relax a bit because your practice is getting long-term NHS funding.
And they are looking for value for money. They are looking for knowing that what they're paying for works. That's where all of these changes are coming from, because they feel like they're spending money and nothing's changing. So I think there's a responsibility on all of us when you're seeing patients and you have a number of patients. Just complete an audit. As a society, we're both doing audits for our practitioners. But if you in your local area, if you just kind of go back to the GP and say, well, I've seen 25 patients in the last 2 months with low back pain, and these are the outcomes, which is where you come back to your MyMark and your other questionnaires. So do have that evidence to take with you and say that this is what I help people with, and I'm also helping their well-being and their lifestyle changes, etc., as well as engaging with the acupuncture. So there's a lady who's got questions.
I was just wondering if anything was done about educating physios, doctors, the medical profession in general, about the difference between people that have done proper acupuncture courses and people who've gone off and done a couple of weekends.
Yeah, I think if you look at page 19 of the toolkit, that runs through where traditional acupuncture provided by Biaxi has an advantage over others. So that's when we've got the arguments there. You know, it's tough for other professionals to sometimes lump it, but that's the case. BACSI members, we're sort of 3-year graduate level trained professionals, so it talks about that here.
As you know, most people who say acupuncture, the patient and half the people, if somebody's sticking a needle in you, it's acupuncture. Whether it's a weekend course or
I mean, there's a couple of arguments there. I mean, the fact that acupuncture is becoming more normal, so people will have perhaps one experience of service of acupuncture for pain when they see a physiotherapist, they'll then go and access acupuncture for other services. So I think over the years, what actually having doctors, physiotherapists using acupuncture has done is it has allowed more people to be comfortable with using acupuncture really and accessing those services. So I wouldn't necessarily see it as a negative, and I would see it as very much a positive. And a lot of our members are happy to work with BACSI members. We've got different levels of our membership. So some of our members are advanced members, so they've done a BSc in acupuncture or they've done a master's degree in acupuncture. But the other training, our normal members have done their BSc in physiotherapy and then they're learning acupuncture at a master's level. But it's not. We don't do acupuncture TCM, we are using acupuncture as an adjunct to our therapy. So there is a difference, and we don't call ourselves acupuncturists. So we are, so if a patient presented with low back pain, I would be using acupuncture to help with their pain, to allow me to do my manual treatments as a physiotherapist. I wouldn't necessarily, some physiotherapists will use their TCM principles because they've gone on and done the study for that. So
because I'm a physio as well.
Okay.
But in the local hospital that I work near, there are a couple of physios there who say, he does acupuncture, and I know for a fact they've done 2 weekends. Well, he's stuck a needle in somebody's side, stuff like that,
Yeah.
But that's all right. They do acupuncture at the hospital.
There is the standard of training is being looked at. There's a lot of courses out there. There's dry needling courses, there's 20-hour courses, 30. Dry needling is the actual practice of acupuncture, the actual putting needles in, but without the TCM principles. It's more of a medical doctor's kind of, they're using acupuncture. I don't really know why it's been named dry needling. You can't do a dry needling course and become a member of the Acupuncture Association of Chartered Physios. So levels of training is something that's being looked at across Europe actually. I think that the most important thing is that we work together for the purpose of acupuncture rather than necessarily
Right, we're out of time and this room's going to be used for something else, but do contact us if you have any questions. Thank you very much.
Thank you.